Hello, everyone. My name is Sean J. Stevens, and I am the admin for Mental Health Wilderness First Aid. I'm also a mindfulness and meditation coach. So, welcome, everyone. I'm very grateful you could all be here. Um, and yeah, Mental Health Wilderness First Aid is a course that that offers mental health skills training for people in remote areas. And we also do things like these free guest speaker events. I'm sure some of you have already taken courses, and I'm sure some of you are signed up. I recognize some names and faces on the when I was filling the sheets out. So really excited about tonight. We have another guest speaker, Judy North, coming up on the 21st. And Judy is going to be talking about suicide prevention in remote areas. So that'll be exciting as well. That'll be a good event, a good guest speaker night. So Day Hagel, who is our director and would normally be here, um, she is actually temporarily in hospital tonight. Um, she is stable and she'll be discharged soon. And unfortunately, she can't make it here in time for the event tonight. So I'm filling in for her. So um, I would ask that you bear with me and have patience and grace for me, as this is already probably a little bit clunky. So I'll invite everybody as people are still kind of coming in. I'll invite everybody to introduce yourselves in the chat. And yeah, if you're comfortable with it, you can say where you are and what you do, stuff like that. So yeah, as you're doing that and as people are continuing to trickle in, I'll just give a quick introduction for Sarah. Sarah, who we're very excited and very grateful to have join us tonight. She comes from a background of outdoor education in a summer camp setting and is passionate about the mental well-being of youth, since going through her own mental health struggles as an adult or as a young adult. She is also an avid outdoors person and understands how important support for mental health conditions can be on backcountry trips. She has been working with Outward Bound Canada as an admissions coordinator for close to 2 years and has spent more than 8,500 minutes speaking with youth and families to prepare them for the physical and mental challenges they'll face on an Outward Bound program. She hopes that sharing some of what she has learned in her time at OBC will help you and your organizations support the mental well-being of youth in an outdoor setting. So just to clarify again, we are recording and we're planning to post a video on our website and possibly on the socials after. So we also want people to feel free to speak and ask questions openly. So if you decide afterward you would like your question or comment removed before we post any video publicly, just send us a message within a couple days and we'll do that. So, sorry, Sarah, okay. Yeah, I know we've got some people from Ontario here and yeah, Kamloops and the island, so cool. Yeah, Sarah, go for it.
Awesome. Thanks so much, Sean. And thank everybody here for being here tonight. I really appreciate you taking the time, and I'm really grateful people want to hear me talk, which is pretty awesome. Today we're going to get into the presentation, asking the tough questions. Hopefully we'll dive into why we should include mental health questions during pre-trip screening. This presentation was created by myself and my supervisor, Jill Zeppa. Big shout out to Jill. She's here tonight. She is my mentor, and she is the reason why I feel like I'm so good at my job. And she's also 1 week out from her due date. So I really appreciate her being here today. And big shout out to Jill for helping me with this presentation. I also just wanted to let folks know that I myself am in Victoria, BC on Vancouver Island, and I'm located on the territory of the Lekwungen people, which is made up by the Songhees and Esquimalt nations. And I just want to be really grateful and mindful that I am an unexpected guest on their lands always, and to always tread lightly wherever we walk. And I'm sure that people have programs that go, and you yourself go into territory that's been stewarded and taken care of by the Indigenous folks that have been here for time immemorial, and just making sure you're aware of that, you're grateful to that, and you make connections with those nations wherever you go and learn a little something. All right. So this is just an outline of the presentation today. I'm going to start off with some trigger warnings. We're not going to go into anything super into detail, but of course, just wanted to let you know in advance that we will be talking about some distressing, maybe triggering topics. I'll give a bit of a disclaimer about the legalities that I'm going to be talking about a little bit. We'll go over OBC programs as a general overview for those that aren't super familiar with Outward Bound Canada and kind of what we do. Then we'll really dive into it. We'll get into Outward Bound Canada's screening process, some important considerations around that. Then we'll get more specific into mental health considerations and how to really set yourself up for success during your intake process. Lastly, I'll kind of highlight all this stuff with a few case studies from our students that we've seen in the past. I'll do a bit of a wrap up, and then I'm hoping to leave about 30 minutes for question and answer and discussion time if you have any questions that are more specific to you or your organization. All right, so this is the trigger warning. Again, like I said, we won't be going into anything in depth, but these conditions that I've listed will be mentioned. So if anything is triggering to you, please feel free to either turn off your camera, take a step back, leave the meeting, whatever you need to do. Just please take care of yourself, be kind to yourself, and we'll surely understand. All right, here's my disclaimer. I really want to remind folks that I am not a legal professional and I'm also not an insurance professional. So this is the stuff that works for Outward Bound Canada. And we have already done consultations with our own lawyers as well as our own insurance company. So please seek out those professional advice for your program, because what fits for us might not fit for you. So just wanted to get that out there. All right, let's dive in. So this is a little bit about me. As Sean mentioned, I come from a background at working at an overnight summer camp in Georgian Bay in Ontario. I started going when I was around 7 as a camper, and I worked there on staff for 4 years. And we did a lot of overnight canoe tripping there. That's kind of the bread and butter of that camp. And that's really what started me off in the outdoor education path. And it made me really passionate about doing what I do. I then went on to study physical geography at the University of Victoria, out here in Victoria, and I specialized in coastal ecosystem studies. I really love the ocean, I really love the coast, and anything that gets me out on the water is my happy place, essentially. I've also been on lots of trips, including taking 18 days to raft down the Grand Canyon in 2021. Can't recommend that enough. It was the most amazing experience of my life, but it also highlighted, the struggles that you can go with when you're dealing with mental health. That one pushed me to my limits, and it really made me appreciate how much having support during that kind of time really makes a difference in the trip. At Outward Bound, I primarily work as an admissions coordinator, so I work very closely with youth and families to talk to them about what the trip is going to be about, how to prepare them mentally and physically for the trip, and also figuring out what kind of supports they might need while they're out in the backcountry and figuring out a way to accommodate that. I also act as a course director during the summer. So for certain courses, I will support instructors and students while they're in the field to do a bit of background logistics. But I like to do this as well to get a really deep understanding of how our programs actually work on the ground in the field, so that I can then go back to families and youth and say, this is what it looks like. This is what you'll experience. Here are the things that you can prepare for. So that's just a little bit about me. All right. Sorry, folks. There we go. So programs at OBC. For those of you that aren't super familiar with Outward Bound Canada, we run youth programming as young as 14 all the way up to around 35. But what I'll be mostly talking about in this presentation is our youth summer courses that run from 14 to 19. These are our main activities, main tripping areas, and the length of program. So it can be anywhere between a 7-day, flat water canoeing trip to a 32-day moving water, whitewater canoeing trip as well. And the challenge level really varies depending on the activity, and especially depending on the length of time, kind of away from home, away from the comforts of society, electricity, all that fun stuff. So this is just to give you an idea of what kind of challenges we have in mind when we're thinking about supporting youth that have mental health conditions coming on the trip. All right, so now I'm going to talk a little bit about our intake process. So the components and the considerations of your intake process will be unique to your program and to your organization. And it'll depend on what you have planned, where you're going, and especially what risks you'll need to mitigate while you're out in the backcountry. So at Outward Bound, we actually start this process by requiring some specific forms to be completed. And again, these have been created with legal counsel as well as risk management in mind. So the first thing they'll be required to sign is a photo and research release form. The photo form is so that we can post photos of their adventures online. And the research release form is mostly so that we can track kind of what kind of outcomes we're getting from students. How much did they like it? How much did they learn? How much are they going to take home with them? Those kinds of questions. They also have to sign a code of conduct form. So that just outlines, what behavior is acceptable, not acceptable, and what we expect of them when they come on an Outward Bound course. And lastly, they have to complete a very extensive confidential medical history form. So depending on the program, we also will require some additional forms to be filled out in a questionnaire format. And those are to help us assess students' readiness, interest, and motivation to come on the trip, and also from their parent and guardian as well, just figuring out where we're at in terms of, do you want to come or do you want to stay home? And that's totally cool, but we really need to figure it out. So after the forms come in and registration is complete, we aim to make an assessment of their forms just prior to talking to the family. We like to do that so we know kind of where they're at, what we're talking about, how much support needs they may have coming into the trip. And then once we've done that pre-assessment, we'll know kind of the next steps in the process. Typically, that's either a phone or a video call to the youth and the family just to connect. Usually, we'll just give them more information about the program, give them a day-to-day, what to expect. We'll also answer the hundreds of questions that they'll be sending or they'll be asking us about the programs, especially if it's their first time. And we also let them know kind of how to prepare mentally for some of the challenges that they may face, catered specifically to any challenges that they are currently going through in their normal kind of home life. This also helps us gauge the connection and how motivated the students are to participate in the program, which is often the deciding factor in whether or not the student joins us on course. If a parent is looking at this like some sort of boot camp or something to kind of set their kids straight, that's often not a recipe for success, but students are generally, when they sign up, super motivated, really want to come and want to get something out of our programs, and that's a really great indicator that we're going to make this work. Sometimes we do have more steps to follow in the process. So depending on the complexity of their condition, how high the support needs are, things like that. And we might include a consultation with the applicant's doctor, specialist, or counseling provider. So all of this is in the context of getting ready for a backcountry expedition. Backcountry in Outward Bound's eyes is somewhere that is 24 to 48 hours away from emergency medical care. So 48 hours away from a hospital, a boat ride, a plane ride, things like that. We also run front country programs, which are typically urban based or in an urban type park that is still very close to emergency medical services. And that process is a lot more simple and isn't as extensive as a backcountry program. So we will engage, like I said, in lots of phone calls, potentially even video calls with the youth and the family, and a ton of emails as well. And we aim to be find the program that fits the youth and their needs. So that's why we offer such a variety of programs, where if a student might not be ready for a 14-day backpacking trip, but they are ready for a 7-day canoeing trip, that is what we will recommend to them. And we'll always try to find an alternative that works better for them. Ultimately, we want them to be set up for success and not be pushed back in their healing journey or feel dejected. We want them to come out of it feeling like they really learned something and they got a confidence boost. So what resources do we use to conduct this important work? Great question. As you already know, we have the intake forms, like I mentioned. We also have a series of what we call supplemental forms. These are designed to kind of gather more information about a specific condition or specific support needs. And it's often in a questionnaire format. So for example, we have specific additional form for those who are living with managing diabetes. We also have a form for those who are going through any kind of post-traumatic stress, things like that. It's just more a specific form with some more specific questions so we can get more information on how we can support them. In terms of our biggest resources, the main one that helps us do our jobs is that we have a very detailed screening manual. So this is a training and a reference tool that we use, and it is required that all staff that engage in doing admissions at Outward Bound follow the policies of this manual. So this manual was created as kind of a guideline for all of the folks that we see and do intake with, and it was made in the best interest of both the physical and the mental safety of the students that we're going to be hosting on course in a backcountry setting. The best tools this manual offers is that it's has very clear acceptance criteria and very clear what we call contraindications to participation on the course. And that depends on a lot of factors. It depends on the challenge level of the course, the activity of the course, and the conditions and the support needs of the student that is applying for that particular course. This manual was created, like I said, in conjunction with our risk management team, as well as our board of medical advisors. So when I reference partners on the slide here, pardon me, that's who I'm referencing. We have a board of volunteer medical advisors that sign up to support us to create the most appropriate and up-to-date safety measures for the physical and mental health conditions we see the most in youth today. So they have some form of experience in the backcountry so that they can take their knowledge in medicine and apply it to a wilderness setting, because it's quite different from an urban setting in a lot of ways. And our instructors need to deal with a lot of complex factors, including group management, which is a massive one as well, on top of going through either a mental or physical health crisis. So we have advisors also that specialize in physical health medicine, but also in mental health as well. So we have a couple psychiatrists that have joined our team, and they will help us not only with mental health conditions, but medication when it comes to managing mental health as well. So they help us both with creating the screening manual as well as updating it as review goes throughout the year. But they're also one of our most valuable assets when we're in the field. So each of our courses will take a satellite phone as well as an inReach device with them, so they can check in with their program team and they can keep track of their progress. But it's also so that if there were to be a mental health crisis that happens in the field, they're able to contact our medical advisors and get advice about next steps, or if, do you recommend taking the student out of the field? Do you recommend going to hospital? Do you recommend keeping them in and providing this intervention? That kind of thing. So they're an extremely valuable resource for us to help us make really important calls like that while our students are in the field. Our team also is engaged in a lot of additional tools for training. So we do a lot of external trainings, workshops. We find resources to keep up our skills and keep them relevant to what youth are facing today. So fantastic example is the mental health wilderness first aid course. I have taken both the basic and the standard, and it really helped me get a lens on what instructors potentially could be dealing with when they're in the field. And that helped me understand what questions I should be asking to give them a heads up on what to do if something like this were to happen. All right, so these are some of the important considerations that we have found to be extremely helpful in our practices and would recommend to anybody else looking into this kind of screening in their intake process. So the first thing I would say is that being trauma-informed is kind of the primary thing that we found that helps us serve our students optimally. We'll often get information from participants because our medical form is so detailed about some life experiences that they've had and kind of some personal history that we wouldn't be privy to if we didn't ask mental health questions. And that really helps us look at the kind of how much have you gone through and how resilient are you as a person? Sometimes we don't get the full story, but that's okay as well. It's kind of up to the comfort level of the folks sharing their story. It's also important to keep in mind that your potential clients or participants will have gone through something, at least in their lifetime. And it's important to understand that what questions and kind of more importantly, how you ask them might be triggering. And that's kind of the last thing that we're looking to do. We're hoping to help them along their healing journey. We're not looking to send them back or trigger them when we're on the phone with them, just trying to get some more information. The biggest thing that we found is that being trauma-informed is the best help in building trust with your participant, with your applicant, on a relationship that is basically completely formed either over the phone or over the internet. Often these people will not have even seen our faces, and we understand kind of how weird that is. And so being able to be trusting in the relationship between you and your client will make a world of difference when you're trying to talk about something as sensitive as mental health. And it also helps you to acknowledge the resilience of your clients. You can see kind of what they will bring to the program and also tell them, you know, I think that you will bring this to the program, and empower them to think, you know, I will not detract from this. I will actually bring something to the table. Another thing we recommend is that you anticipate barriers. In this kind of people work, there's always going to be barriers. That's just kind of unavoidable. But if we do our best to be knowledgeable about the barriers that are presented, we can do our best to try to help them over the barriers or remove them entirely. A couple examples would be language. So thankfully, a few people on our team speak French. So for anybody Quebecois who's applying, we can get someone on our team that speaks French and have them help them out. But for example, we also host a lot of newcomers to Canada. And so there may not be somebody on our team that speaks the language that this family is speaking. So it's important to keep that in mind, especially if you are serving particular communities or populations with your forms, as well as your process and your staff. Another thing to think about is something like internet access. All of our forms are done online through our registration portal, but we work with remote communities that may not have as good internet access as somebody who's applying from Vancouver, for example. So you need to be ready to, you know, mail out all of your intake forms and put them in manually or fax them. I don't know if fax is still a thing, but if that's what the community or the person is using, doing that. And essentially just getting creative and trying to accommodate folks as best as possible. The next thing is also to have a sense of cultural competency or just some knowledge about the community or the population that you're working with. Just doing some preliminary, you know, baseline research just to see a little bit of the history, a little bit of what they're like and their values is a really great way to not go in blind, essentially, and be able to relate to them on a human level. And the last thing I'll say is that all of this should be confidential. Again, please consult your legal providers, your law providers, about confidentiality, but we treat mental health conditions the same way that we treat physical health conditions. So the disclosure of that is completely confidential and only shared with the appropriate people on our team that would need to know that. So for example, the instructors that are taking the students on the course. But again, consult with your legal professionals. All right, so let's talk a little bit more about mental health specifically. So if you're comparing it to the physical health realm, mental health is definitely more of kind of a gray subject area that's subject to a lot more stigma than the physical health area, and is often a lot more sensitive to talk about with folks because of maybe stigma in society or within their family or their culture or what have you. So just knowing that it's going to be a little bit more sensitive when you talk about it is good to kind of know about that. But at Outward Bound Canada in particular, when we see that someone is dealing with a mental health condition, we are looking for certain things that they're applying in their life right now to be ready to take on one of our programs. So the first thing that we're looking for are triggers. So for example, if they're anxious, what is the trigger to their anxiety? We also look and make an assessment of if that trigger will be present on the course or has the potential to be present on course. So for example, if somebody has anxiety that is triggered by really, really big crowds and loud noises, going on a 7-day sea kayaking trip with 9 other youth and 2 instructors likely isn't going to trigger that, but that's something we'd want to talk to the youth about. The other thing we look for is coping strategies. So when you get triggered and when you feel anxious, what are the coping strategies that you have in place to calm yourself down or to get you through that moment? We also do an assessment of if they are appropriate for a backcountry expedition. So for example, if you're on a 32-day whitewater canoeing trip and your coping strategy was, I need to take a second to myself, I need to just remove myself from the group, do a bit of journal reflecting, take a deep breath, and then I can come back and it's fine. Great coping mechanism. If your coping mechanism is, I need to scroll on social media and then take a nap for 9 days and then emerge from hibernation, not super appropriate for a backcountry trip. So we're looking for something that the coping mechanisms are there and that they're appropriate for the trip that the youth is going on. We also look at, I've mentioned this before, but their motivation. So did the student kind of really want to go on this trip? Are they super stoked? And despite the fact that they feel a little bit anxious, they still want to come, they want to make it work? Or do they feel that they're being forced into this experience by, parents or guardians? That's another big thing that we look for, because often that is the make or break situation for having a kid either come on trip or them stay on trip if they do go through a mental health crisis while they're out in the backcountry. And lastly, we ask for the supports that they need from our team. So from our instructor team, from our logistics perspective, what do you need? And are they feasible in the trip setting? So do you need to be able to take a deep breath and stay away from the group for 5 minutes? That's great. But if you need to have a call with your mom when you're deep in the woods and you have no cell signal, not as feasible. Is there something else that we can do? So it's about looking for those things, but also the feasibility of how they cope with those things in the backcountry. Also, something to keep in mind is a phone call versus a video call if you do want to make contact with the youth and the families. Typically, us at OBC will use phone calls, because otherwise we would be in video calls literally all day and I get fatigue really bad. So I personally would be a zombie by the end of the day. But video calls can be really great for certain populations or individuals where they feel a lot more comfortable seeing you as a real person and not just a disembodied voice on the phone. So asking what they're comfortable with, what they prefer, is a great way to kind of build that connection, build that trust. And they can, read your body language and see your facial expressions and things like that. Also, how you ask questions matters. So for mental health, again, very touchy, very sensitive subject for a lot of people. If you ask it in a way, I find you need to find a middle ground a bit. If you ask it in a way where you sound like it's very clinical, but you also sound like you don't care, they might not love that. They might not feel inclined to kind of share more about their experience. But on the other end, if you really baby them and kind of tiptoe around the subject, then they might also think that's weird and not really want to tell you more because they don't want you to react oddly. So what I found is that when you're talking to them, ask them a direct question. Don't kind of waffle around the subject. but do it in a compassionate way, and also front load the fact that you're going to be asking sensitive questions. So saying at the beginning of the call, thank you so much for doing this with me. I know that this can be kind of scary and a little intimidating talking to somebody on the phone about your mental health. I'm here for you. I'm here to make sure that you have the best trip possible. I'm going to be asking you some questions that may make you uncomfortable. Please tell me if they do. We'll move on. But otherwise, I'd love you to tell me as much detail as you're comfortable giving me. And also allow opt-outs as well. I found that if the phone call is getting fairly emotional and you're talking about some really heavy things, saying, you know what, we don't have to talk about this today. We can connect another day. We'll take a break, take a breather, recoup. Maybe we'll connect again next week over the phone and see what we can do then, see how you're feeling. So basically allow them an out to make sure they don't feel backed into a corner. But the other thing, or the one thing with that, is that you need to make sure that folks understand your limitations on kind of the organizational side of things, where if someone isn't willing, or they don't want to talk about a specific condition that they're going through or something they're struggling with, absolutely, I totally respect that. However, if we don't talk about this and the supports that you need on course, we are not able to host you because it's too much of a risk for us to take you and for something to happen and then for us to evacuate you if you go into crisis. So just being transparent with them and saying, this is why we are asking these questions. If you don't answer, you completely have the right to do that. However, this is what will happen in the next steps. And lastly, also letting them know, and don't be afraid to do consultations with their doctor, the rest of your team, and if you have the medical advisors. Getting another lens, another view on kind of how we can accommodate this person and what other supports that we can put in place for them from different sources is a really great idea. And it's a really good way to find creativity and making sure that we can get this youth on the trip and make them have a really, really fun and successful time. Speaking of success, how to set up for success. This is just the things that we at Outward Bound recommend. First and foremost, build a strong rapport. If your clients feel like they're a number when you're talking about mental health, that's not a recipe for like open communication. So building a strong rapport with the youth and the family and getting them to trust you will make sure that there's open communication and genuine interest in them as well. I found is a really great way to make sure they know that you are here for them and you want them to have the best experience possible. And doing the strong rapport, it doesn't take much. It takes, really listening, tuning in, making sure that you're connecting with them on a regular basis, and just listening and remembering the things they tell you. Part of one of our questionnaires is the youth filling it out, telling us about their hobbies and their interests and what they like to do. And often we like to start the phone call by saying, hey, you said you were taking Taekwondo. How's that going? Are you at a certain belt level? Do you have any competitions coming up? That kind of thing. So they know that you're interested in them as a person and not just another client kind of thing. The other big recommendation I have is do things as early as possible. I have learned this the hard way and it really sucks. What I mean by this is when you get a registration in, do a pre-screen as early as possible. See if there are any things that you definitely need to talk to the family about in terms of support needs or accommodations or anything like that, and get it started as soon as possible. Because if you leave it to the last minute, and then suddenly you find out that their doctor is not recommending them to come, or something on their medical form is unfortunately not allowed to be accommodated on your trip, and they've already made those plans for the summer, and you tell them last minute that they can't come on the trip, big emotions will come up from both the youth and their family, and it's just not a fun time for anybody. Whereas if the application comes in January, you have a few phone calls with the family, you try to do the accommodations, but it doesn't work out. They have, 6 months to figure out a backup plan for the summer. So do things as early as possible to give the family as much notice as possible if for some reason their youth can't join you on the trip. Also use the tools at your disposal. There's so many resources out there. The internet is a great place. Day, and this organization, great resource, lots of trainings and workshops out there. And a lot of them are free. So I totally recommend taking a look at what's out there. And a lot of it is very, up to date. This is what we're seeing in youth. These are the trends that are going on right now. And it's just a really great way to kind of see what the youth are going through and see how you can change your practices or update them. And lastly, transparency and compassion are your greatest assets. Those are the things that really make or break a relationship with a youth and a family. So transparency is just being able to tell them, this is why we do things. This is the reason why I'm asking you these questions. And compassion is not necessarily being so caught up in the emotion that this family is feeling that you can't do your job properly, but it's knowing, these are the feelings I'm sure you're feeling. I feel bad, and I know what you're going through. Let's work together to make something else work. But those are the two things that are really going to set you up for success, especially in building a rapport with your clients. All right, so I'm going to jump into case studies now on some of the participants that we have seen. Some of them are my participants that I've worked with in the past, and some of them aren't. But I just wanted to show you kind of a bunch of different angles of where screening has taken us and what the different outcomes of these cases have been. So this first participant here, they were 16 and they were applying for a 14-day sea kayaking course out here on Vancouver Island. I was able to talk to mom a bunch, and she was really great at giving me lots of information on this participant's background and what they've been going through, and kind of her want for them to come on this program and be able to come out of it with a lot more confidence. I will say that they were a last minute application, and so there wasn't as much time as we would normally like to have conversations and connections with the youth and the family, but we made it work. When I asked to talk to the youth directly, they typically were either at school or they were at their job. And so with all of the information that mom had provided me, I felt really confident that we were able to support this individual and coming on the trip. Pardon me, and that mom had disclosed quite a lot. So the outcome for this one was that after talking with mom, they were approved to come on trip. And I was actually fortunate enough to be at our base in Courtenay when this trip was starting. And so I was able to meet this participant and have some conversations with them. Unfortunately, this led to an early departure from our course. So that means that they did not complete the course. They had to be taken out of the field and sent home early. And what had actually happened was mom had not told the participant that they were coming on course until 2 days before they were set to depart. They were then arriving on course, being dropped off. Their phone was taken away. They weren't really able to tell their friends where they were going for the next 2 weeks, and they didn't really have any information about what was going on this trip. So what ended up happening was our instructors are really awesome people. They made them feel super welcome on trip, but they still felt really uncomfortable. I mean, imagine getting shipped off for 2 weeks to a new place, not knowing where you're going, what you're doing, who you're doing it with. And so, unfortunately, this student got so anxious and stressed out that they didn't poop for 10 days. And so that was, making them super uncomfortable, really did not want to be there. I completely empathize with that. And so eventually our program team decided to take them off the trip and have mom take them home. So this kind of highlights one important thing of really involving both the youth and the family when you're doing intake like this, because it really makes sure that the youth knows what they're getting into. And if I feel like if I had been able to speak with this youth directly and really prepared them for what they were about to get into, they would have had a much better time on trip and actually been able to complete it. In fact, when one of our program team members was talking to the youth as they were bringing them home, they said, I'm actually kind of sad. I really wish that I could have stayed on this trip because I was making friends and I was having a good time. But, my mom just didn't tell me. And so my body is just, making me leave, essentially. And so that was just kind of a really disappointing outcome, and also highlights that despite your best efforts and how many questions you ask, you don't know the whole truth behind, what's going on in the family or what's going on in their life. So not being too hard on yourself, especially when you feel like you've done everything that you can to ask those questions. So the next participant here we have they were a 15-year-old who was applying for our 7-day Connecting with Courage canoeing course. Connecting with Courage is a specific course that we run in conjunction with the Maddie Project for students that have faced bullying at school and who just need a bit of an extra confidence boost. And so on their medical form, they checked off anxiety, challenging life events, and homesickness. And so when we did our screening with this participant, we asked all of our typical questions we did around anxiety, kind of what triggers it, how do you manage it, how are things going, that kind of thing. We also consulted with their mental health provider because they were currently seeing a counselor about this. And the mental health provider gave us the all green, good to go. So the outcome with this one is that they were approved for the trip. And they thrived. They had an amazing time, and such an amazing time actually that they have applied again for a different course this year, and they're super excited to up the challenge level despite the fact that they're still experiencing anxiety. And I just wanted to highlight the difference between these two cases is informed consent. So when the youth knows what they're getting into and you empower them to make that decision for themselves, the outcome is radically different. One ended up being an early departure and perhaps feelings of failure, feelings of dejection. And one was a really confident kid coming out of a course and wanting to challenge themselves again and come back a second time. I have two more case studies for you. So this one was a 20-year-old participant who was applying for a 14-day expedition with the Canadian Conservation Corps. We partner with the Canadian Conservation Corps to deliver this 14-day backpacking expedition, and it's for youth that are between 18 and 30, just for context. So on their medical form, they had presented with anxiety, some challenging life events, depression, emotional regulation, and they had a history of a suicide attempt or a gesture. So they had gone through a lot of things in the mental health realm. And so we really wanted to make sure that they would have the appropriate supports while on trip. So throughout the entire process, we have talked to them, given them the outline of what the trip would look like, told them some examples of the challenges that they would face. And after all of this had happened and we talked to them, they had self-selected out of the program. So we spent a lot of time speaking with them, making sure that they knew kind of what challenges that they would come up with. And they said, you know what, I don't feel comfortable and I don't feel like this is the right time for me to join this trip. I think that I will take a step back and I'll try again another year, just because of where I'm at now. I don't think it's the right time. And this is such an awesome outcome, even though they didn't join us on trip, because we had empowered them enough to say, this isn't for me. And they made an informed choice to be able to take that step back instead of maybe us not describing the challenge appropriately. They get there. And once they're out on trip and on the land, they say, oh my gosh, this is not what I was expecting. I can't do this. And then backing out. This was, an empowering decision. This isn't for me right now. I can come back to it later. I'm going to step out. Then the next or the last participant that I want to share with you, they are 16 years old and they're applying for our West Coast 21-day sea kayaking and surfing program. It's a long program, 3 weeks away from home, away from showers and, phones and electricity. That's quite a challenge, especially for youth coming out of a pandemic that were basically glued to their phones. Their medical did list challenging life events, depression, nightmare terrors, post-traumatic stress, and suicidal ideation. And so we were chatting with that participant and their mom, and we were just trying to see what kind of accommodations would be made, if there would be any triggers while on course. And when we were consulting with their medical provider, we had sent them a request for consultation with their counseling provider. We unfortunately did get a call to let us know that the participant had been hospitalized due to a suicide attempt. I will say they are fine. They are doing really well now. But they let us know, A, because we had built such a great relationship with the family, but B, we kind of stipulate on our forms and say, if anything changes, please do let us know, because we want to have a chat with you about it. So unfortunately, in this situation, Outward Bound had to make the decision to say, you're not ready for the trip quite yet. Let's try again next year. And this is probably the most difficult situation that we deal with as admissions coordinators and folks that are doing intake, because it's really heartbreaking when, and this family was exactly this example. It's really heartbreaking when youth and their parents are really set on coming and really think that they can do it, and then we unfortunately have to come out and say, we don't think you're ready. It's too risky. This is going to be too much of a challenge, and we really want to make sure that you're safe. This in this particular circumstance, they understood. Their hospitalization was about 4 months out from the program, and that's just not enough time to get ready. It's not enough time to put in those coping mechanisms, those supports that they need. And this particular student was very understanding of that. And the most important part that I can emphasize with this is, so this particular student, this year is their third year of trying to come on an outward bound expedition. And good news, we think that it's going to happen this year because they do have the supports in place. They have the coping mechanisms, and we really feel like they're ready. But in the past, the reason why they have tried so many times to apply to our program is because we have built such a solid relationship with them and their family, and we've worked with them throughout the year to make sure that they can be optimally ready for our programs. Like, we've kept in touch, we've made sure that they know that we're here, that we hope that we see their application again, that we will work very closely with them and try to get all the accommodations put in place that they need to come on our programs. And yeah, we think that they're going to do it this year. So hopefully a happy ending for this particular applicant. All right, just a little reminder. Again, didn't go to law school. Please make sure you provide or you get your own legal counsel for insurance, and make sure that your programs are well covered for anything relating to outdoor activity. So just to wrap it up here, first bullet point we've already gone through, but I just have some kind of closing thoughts around all of this. So as much as you can prepare for as many conditions, situations, all of those things in advance, there will always be exceptional cases. There will always be different support needs that are requested from your students. So be as accommodating as you possibly can be, not only because it's the law, but also because you want to make sure that as many youth can participate in your programs and benefit from your programs as possible. That being said, also, don't be afraid to stick to your guidelines, in the sense that many families will, it is true that your participants know themselves, their brains, their bodies best out of the two of us, but we know our programs the best. And we know, the challenges that will come up. We can envision them. We have had other students with similar life experiences and conditions go into the field and find certain things challenging. So if there's something that is going to put that particular student at risk, or your instructors at risk, or the rest of the group at risk, stick to your guidelines and, don't feel bad about having to say no, as awful as it might feel, because at the end of the day, you are doing what's best for that particular student and the safety of them and the other group that's going to be going out with them into the backcountry. Last thing, consult mental health professionals. Clearly, we found people that like to work for free, so I'm sure that you can too. And they're a really great resource, both for creating your guidelines and helping to shape your intake, as well as in the field on the fly medical health advice or mental health advice. Use external resources. Another plug for this wonderful organization, if you haven't already done it, the Mental Health Wilderness First Aid. There's a bunch of trainings out there that are wonderful and super applicable to the work that we do working with youth in different settings. And there's always another tool that you can put in your toolbox for sure. Also, keep up to date with common conditions. And when I say that, I mean, what are youth experiencing these days? So, 20 years ago, we probably would have been seeing different youth than we do now. Even 5 years ago, before the pandemic, we saw different youth than we did last year. So just making sure that you're keeping up with what struggles the population you're serving is going through, and making sure that you're up to date on kind of best practices and newest research. That's the best way you're going to serve your clients. And lastly, be trauma informed, come from a place of support and curiosity, and not what's the one thing that you're going to say that's going to make me say, nope, you're not coming. Let's say, what can we do to make sure that you do come and have a wonderful experience and work with compassion, because we do work with lots of folks from various different backgrounds, and we need to make it as accessible and welcoming to everybody as possible. All right. Thank you so much for listening to that. I'm sorry if I flew through that. I was just really excited to get everything out. I'd love to open up the floor to questions, comments, queries, anything that you folks, I haven't checked the chat yet, so if there's a bunch in there, I'll check it now. But thank you very much for listening.
Sarah, I have a question for you.
For sure.
You spoke a lot about the youth, but I'm wondering if you're doing the same sort of checks for your adult programs.
We are. Sorry, I should have specified. I am the specialist in open enrollment, so working with youth 14 to 19, but we use the same protocols and procedures for all of our youth 18 and up as well. The only thing that's different is that we don't need parental intervention or consent to speak to the youth if they're 19 and over.
Right. And then how much success are you finding in getting permission to talk to their health teams if you want to talk to their doctors?
I would say maybe 5% of people give us pushback. Usually the folks, we explain why we do it and exactly what information, we send them the form, before we engage with their mental health professional, saying this is what's going to be on it. These are the questions we're asking. And we really don't get that much pushback because, again, we are coming from a place of how can we support you better? How does this mental health professional, view you and see what kind of accommodations that you might need?
Great. Thanks.
Welcome. Anyone else? No worries if you don't.
Hi, Sarah. I've got a question too.
Sure.
Kind of related to what James was just asking, but any changes you would make? Well, I guess a little background. We do youth programming and adult programming.
Okay.
Normally it varies from 1 day up to like 5 days. Would you have anything that you would do differently for folks coming to join us for 1 day?
Yeah, for sure. So we definitely do have different protocols for backcountry versus what we call front country, or like very short trips. And essentially it's the same, but not as extensive. So we still ask, what conditions are you managing right now? What are your triggers? What are your coping strategies? But unless it's something that can kind of go life or death, like diabetes or something like that, then we often won't engage with their doctor or their mental health professional unless, the family has made it very clear that this is a really big situation that needs to be managed. I will also say that for front country trips, we typically are with schools or community groups, and we will have chaperones on the group as well. And those chaperones are ultimately just as responsible as our instructors for helping to manage behavior, manage any kind of special accommodations that particular youth needs. So I would just say it might not be as in depth, but still ask the questions and like triggers, coping mechanisms, any kind of support that you might need on this trip.
Okay, thank you, Sarah.
Thanks.
Hi, Sarah. Question for you. Have you all ever had any challenges with families or participants not disclosing mental health challenges in that paperwork process, like as you go through it?
We sure do, unfortunately, and that's completely their right too. But we have had some instances where non-disclosures has happened, and that's what we call them. One of the kind of caveats that we have, or one of the disclaimers that we have in all of our paperwork, our pre-paperwork, is that if there is a non-disclosure of a condition that is serious, that may lead to either potentially not being able to join on course, depending on when we find out about it, if we can make the accommodations in time, that kind of thing, or if we find out about it on course and it's not manageable moving forward, then it may result in an early departure from the course. So I would expect it almost. There are some folks that just keep things really close to the chest, and they're really worried about maybe discrimination, or there's just a stigma. And it really depends on the situation. If it's something kind of minor and we definitely can accommodate it on course, then it's just next time, let us know. But if it's something really major that could affect the safety of the instructors or anybody else on course, then it's you may not be able to join us, or you may have to leave early. Does that make sense?
Yeah, definitely. Thank you. I know that's been a challenge that we've had where it's kind of going back and forth, and the information that they give is a gift, and also sometimes, like you said, there's stigma, and folks feel really concerned about
through and trying to do better, essentially. But something that I have just kept in mind is that everybody has the right to disclose what they want to disclose. Unfortunately, I am just kind of the enforcer of outward bounds policies in my role here. So as much as I can try to work with this family or this individual, at the end of the day, if the policy says that I cannot accommodate this, then I can't accommodate it. And all I can do is try to keep that relationship with them and see if we can try again at a later time.
I have some more questions if no one else does, but this was born out of a need to do this for you and your participants at Outward Bound.
I think so. I
Yeah.
am definitely not the best person to ask because I've only been there just about 2 years. But our manual did used to be a lot more sparse in that we did only screen physical health conditions. But we have a really awesome kind of research department that was seeing, the rise in youth experiencing mental health and needing mental health supports. And so when we saw that there was a way that we could support them, and support our instructors as well who are struggling, a kid would show up and maybe they knew they had a twisted ankle, but they didn't know that they dealt with anxiety. And we said, this is also risk management for us because then we can let our instructors know and they can prepare for that while they're on trip.
Yeah, and I'll just speak anecdotally, but I say we're probably having 30 or 40% of our students coming in with a self-diagnosed mental health challenge these days. And I would say the stigma is coming down, where we're getting a lot more self-declarations and people looking for the help and the resources. But
For sure.
but definitely with you, it's a risk management issue for us and our instructors because we're not mental health practitioners.
Yeah.
And a lot of times they're just not able to deal with the problems that the students are facing.
Exactly. Yeah. And that's why it's really important to kind of think about your program and who is delivering that program. We often say to folks who might be looking for like therapeutic, some folks are looking for like wilderness therapy. And while that's an extremely valid and probably really awesome way to kind of treat mental health, our instructors are not trained to the degree of a counselor or a psychiatrist or a psychologist. So not only is it about, we perhaps can't provide the support and the help that your youth needs. It's also our instructors are not trained to deal with that themselves, and they also have to manage 9 other youth on the trip while in risky conditions. And there are bears and other things that are out there. So it's not just about the safety of that youth; it's the safety of everybody that's involved on that trip. But great question, thanks, James.
Yeah, thanks, Sarah.
Hey, Sarah, thanks so much for the presentation. I just had a quick question. I'm working at Strathcona Park Lodge, and our programs are open enrollment, so someone can just go on the website and enroll for our youth summer programs, which I've been like implementing some of these processes, but would love to implement kind of a more in-depth process. And just curious around if is it open enrollment in the sense of someone enrolls, pays a deposit, and then you do this process, or would you kind of backtrack and do it a different way? Or I'm just curious on like that back end.
Yeah, for sure. Great question. So kind of the order in which we do things is we have our website, we advertise all of the different courses that you can do. When someone decides to sign up, we have a registration portal that basically moves them through the hoops, essentially. And there are certain forms that are not being required or are not required to be filled out. So for example, your sizing chart, because we know 16-year-old boys can go from like 5'2" to 6'2" in a year or whatever. And the applicant questionnaire, that's something that can be filled out in their own time. But the ones that are required to even be able to hold a spot on the course are their confidential medical history form, the code of conduct, and the photo release and research release. So we almost create that block by saying, if you don't fill in this form and let us know kind of what support you need and what we need to ask about, then we're not even going to let you register on the course yet. If that makes sense.
Yeah, thank you.
Thanks. There aren't any more questions, and if you're like me and take like 5 to 6 business days to think about questions, I'll just put my email up on the screen here. Everyone is more than welcome to shoot me an email. I clearly love to talk. And if you have any more questions about anything, myself and my team would totally be happy to share anything and everything. Maybe not everything, because there's like propriety stuff that we can't share. But yeah, it's been a pleasure speaking with all of you. Thank you for your questions. I'll still hang out for the next 5 minutes if you do have questions, but if you want to peace out and go to bed, if you're in Ontario, I totally understand. And that's my contact info.
Thank you so much, Sarah. That was awesome. I loved that, and I liked the fact that you wrapped up early. Yeah, like you said, for the people in New York and Ontario can get to bed at a semi-decent time. Yeah, that was amazing. I really liked when you were talking about you know, what's appropriate for self-care measures. I got a chuckle about the scrolling on social media. I don't know if that's ever an appropriate self-care method. It's not for me anyway.
Yeah, we see quite a lot of interesting responses to those questions sometimes, but you know, if it works for you, who am I to tell you it's unhealthy or not? You know,
Yeah,
it's just if it's applicable on a sea kayak in the middle of the Quiet Sound kind of thing.
yeah, for sure.
I got one more if no one's gonna go.
Sounds good.
I got a lot more actually, but I won't pepper you all with them. What are you doing for staff training to get your instructors ready for this stuff in the field?
Yeah, for sure. We've kind of been mixing it up the last couple of years. Typically, we will hold regional staff trainings where all of our instructors who are available to make it can come. And this year in particular, I'm actually going to be going and joining and talking to them about kind of the admissions process and what they can expect to see. It's not a requirement right now, I believe, but it's a strongly suggested that you take actually the mental health wilderness first aid course or something very similar to this so that they know the basics of how to deal with a crisis in the field. And we also have Outward Bound last year launched the Outward Bound Training Academy for Outdoor Professionals. And that is targeting folks that either want to get into the industry or want to change career paths and get some really awesome training from outdoor educators that have been in the field for a long time. And that course offers, again, mental health wilderness first aid training. They go through kind of scenarios on, you know, what happens if a youth on the course is experiencing an anxiety attack or a panic attack. What do you do? How do you help? When do you call in backup? When do you send them home? That kind of thing. And we also go over our Outward Bound policies with instructors prior to every trip as well, just to give them a bit of a refresher. And they're always in contact with our program team as well, like throughout the trip, if they have any questions.
Is Outward Bound paying for the training for the staff?
Yep, so they'll be paid for the training. The Outward Bound Training Academy, which is kind of a separate section of Outward Bound, is fully funded by the federal government, so it's totally free for anybody that wants to sign up. But yes, Outward Bound pays for instructors to come to our, typically it's about a week-long training, and they go on an expedition as well.
Yeah, that's right. I was just speaking mostly about the mental health wilderness first aid training.
Oh yes, yeah, we pay for that. Yep.
Very cool, great. Cool. Thanks very much.
Thanks, James, for filling in all the questions.
It's something we're dealing more and more with. Like everybody is. I'm sure employers are facing it with staff as well. I know the staff, a lot of the adventure companies in BC are starting to talk about it just for staff, not even participants, right? Having to deal more and more with mental health challenges. So
yeah, it's
great.
something. Oh, thank you. Yeah, it's something that obviously we're noticing is an increasing trend, especially after the pandemic. And we want to make sure that everybody feels supported. We might not provide, first aid or like crisis intervention with instructors themselves, but we want to make sure they feel supported, and like we're backing them up by saying, hey, here's a heads up. This is what you might be dealing with. Do you need help with dealing with any of this? If so, let us know.
Yeah, great. Thanks very much.
Thank you.
I just had another quick question if you have time.
Of course, yeah.
I'm just curious around if you're doing the intake process, say like January, and then the program isn't until July. Is there, I know you said that like folks can update you or update their forms, but is there something within this process where you then like call them a week out, or I guess, yeah, just curious around that.
For sure. Another great question. So typically, if the program starts in July, I will have in my calendar for all of my clients a list of them that are going out kind of at the beginning of July, just to shoot them an email and say, hey, can we connect over the phone again? Just want to chat, see how things are going, and kind of give them an opportunity to give me an update that way. So we do make, like you said, if they're applying right now and I had the conversation with them today, kind of sometime in May, maybe even June, depending on if their course is going out in August or something like that. I'll check in with them again, connect with them over the phone, and then 1 week out from the program start, we send out an email to all the participants and their families saying, 1 week out, don't forget, hop on your plane if that's what you're doing. Also, if anything has changed, please let us know. So we give a few reminders as kind of the year goes on. And oftentimes people will have 8,001 questions. So they'll be contacting you like, what about these hiking boots? And you're like, those are good, as I told you last week. And in that time, you're like, how's Jaden doing? Or how's their anxiety? Like, how's their counseling going, kind of thing. So there's lots of opportunities to connect, but recommend using your calendar as a reminder, kind of in your less busy time, just to check in with them again.
Awesome. Thanks so much.
Thanks.
I don't know if you're keeping up with the chat at all, but you are getting just tons and tons of thank yous in there.
Oh, thank you, everybody.
Yeah, it was great. It was really wonderful. I'm really glad that I got to be part of this for sure.
Thanks, Sean. Yeah.
I'm just here to be a fly on the wall, but this was fun, Sarah.
Thanks, Jill. That's my boss.
Here to support you.
Also, shout out to my grandparents who are here as well.